In this video, we're going to talk about minimally invasive proctology. If you suffer from hemorrhoids, there are various treatments for the hemorrhoids. The most simple treatment for the hemorrhoids can be done in the clinic setup itself with no need for any anesthesia. I do the injection therapy as well as the banding therapy for the hemorrhoids in the clinic, and the patients can get back to their work on the same day. If the hemorrhoids are severe grade, then they need operations in theaters. However, I do perform minimally invasive procedures for these hemorrhoids in the form of Rafaelo and THT procedures. In the THT procedure for the hemorrhoids, with the help of a Doppler and miniature instruments, we ligate the blood supply to the hemorrhoids, and hence the hemorrhoids shrink in size and the hemorrhoidal symptoms subside completely. There is no cuts involved in this operation and the recovery is quite quick. If you suffer from anal fistula, there are different modalities of treatment for the anal fistulas, including ceton insertion and laying it open. However, I do perform video-assisted anal fistula treatment for some of these fistulas with early recovery and with less pain. In the video-assisted anal fistula treatment, we aim to pass a small camera through the external opening of the anal fistula with a view to treat the anal fistula tract, and there is no need for any cuts involved in this procedure. We also put a small stitch into the inside opening of the anal fistula, and the aim is a quick recovery with no significant cuts involved after the operation. The other condition in the minimally invasive proctology which I offer is for the pilonidal sinus in the form of endoscopic pilonidal sinus treatment. In the endoscopic pilonidal sinus treatment, we aim to pass a small camera through the external opening of the sinus and remove all the hair, which is the main reason for the pilonidal sinus. We then treat the tract and send the patients home on the same day. It is a minimally invasive procedure with early recovery, early back to work, and with minimal pain. The traditional operations included bigger operations with significantly prolonged recovery time. However, in the endoscopic pilonidal sinus treatment, the recovery is quite quick and are associated with significantly less pain. For the anal fissure, the minimally invasive procedure involves Botox injection into the sphincter muscle and also fissurectomy, wherein we clean the base of the fissure. This helps in healing the fissure quickly with no need for any major operations. And vast majority of the times, this is a successful operations with a very quick recovery time. For these procedures, they are done as a day case with the aim to discharge on the same day of the procedure. The recovery time is quick, and I expect them to get back to work within few days' time in vast majority of the cases. Any surgeries carry risks. However, the risks associated with these procedures is very low. There is a small risk of pain, bleeding and infection, which I always discuss with the patients beforehand in the clinic, and these risks are significantly low compared to the standard procedures.